patient chose it to make their lives better.
The infection doesn't kill the patient, but the infection will permanently damage the penis.
The complication happens, well, it really, make the patient and the surgeon really feels really hard and bad. Hello, I'm Sean Sangwon Park from South Korea. I'm practicing in Seoul. My specialty is penile prosthetic surgery, especially inflatable ones. Penile prosthetic surgery, when you talk about the surgical result, infection rate is a critical point. Low infection rate is one of the most important things because when the infection happens, you cannot really treat it medically. And low infection rate is something we all prosthetic surgeons we want to achieve. So I came here for visit Dr. Francois Eid, who invented no-touch technique. I wanted to see how he do the surgery and I want to learn how he does it.
My name is Francois Eid. I'm a urologist, director of advanced urological care, a practice that is entirely focused on the treatment of advanced erectile dysfunction with penile implants. For many years, we had an infection rate of about 2 to 5%, and we were very frustrated because infections would happen. Even if everything was perfect, you would get an infection. So it was almost like playing Russian roulette. Around 2003, we began looking at what were the organisms that infected these implants. And we discovered that most of the organisms were from the patient's skin. And it was very difficult to sterilize the patient's skin. And so I decided that I would do the implant without touching the skin.
It wasn't there before, he invented it, but why? To reduce the infection rate.
Essentially, we do the surgery without touching the skin. So neither the instruments, the penile implant, or the gloves touch the skin. In that fashion, we reduce the infection rate to 0.5%, and that's based on over 3,700 patients since 2006. So for about 11 years.
So Dr. Eid's surgery, his no-touch technique is very notably very impressive because his infection is by far the lowest among all the other, literature has been shown.
That's actually the best question that you can ask me, because many patients assume that if you get an infection, you can just give me antibiotic and the infection will go away. And it's not, unfortunately, that doesn't happen with penile implants. When there is an infection, you have to take the implant out. And then there's nothing in the penis, and then the penis will scar down and prevent from doing a penile implant the nice way later on. It's possible, it's a lot more difficult, and the penis will be a lot smaller. So the infection doesn't kill the patient, but the infection will permanently damage the penis.
Penile prosthetic surgery is not for life or death, but it's for patient satisfaction, actually. I would say patient happiness. Necessarily, they didn't have to do it, but they chose it to make their lives better, but still they had a complication. It's a lot of burden. So to prevent the infection, actually it's for the better patient care and for the better patient management.
Many patients who have erectile dysfunction don't respond to medications and they want a penile implant. But they're very scared. They're very nervous. And one of the reasons that they're scared is the possibility of an infection. So it's a very serious problem, and we want to make sure we minimize this for the patient.
And I truly believe that a good surgeon should always think of the best of the patient, not himself. Like this, his surgery, a notice taker will take more time and more energies, but still, this surgery is not for the surgeon, but for the patient. He made it very clear that we surgeons should serve the patient. So I do agree with his philosophy of how to be a good surgeon and being a good doctor. So actually, it's a pilgrimage for myself, endless pilgrimage. So being a surgeon is a kind of, my lifelong job is learning. Every day there's a new techniques developing, and all the other surgeons are doing their surgery one or the other ways. I can always learn better, and I can always see how they do it. So there's a new surgeons coming. At the same time, there are a whole lot of great surgeons out there I want to see.
Dr. Park also is extremely interested in instructing and teaching patients and providing information, and he has really great videos of his surgery that people can look at, which I recommend to all men before they're having a penile implant. As a matter of fact, some doctors also look at the videos to learn how to do the surgery from him.
Learning is not just learn from the others, but while you give a learning to the others, let's say I'm training others, it's a good learning chance for you as well, because you have to see your surgery objectively. You have to tell your ideas exactly with the word. While doing so, you kind of categorize and the reasoning and all those stuffs happening in my own head, and it actually made me recognize more about my surgery.
Now, what's great about him is his complete philosophy about the way he treats and handle patients, and that he has an extreme good judgment and experience to bring when performing an operation on a patient. I think those are important qualities to have when you're a doctor and you treat a patient. I think his philosophy is outstanding, and combined with his technical skills and good judgment makes for a formidable doctor.